Amanda. I'm the occupational therapist and lymphedema therapist here at Cornerstone. Today we're going to talk about myofascial pain syndrome. So myofascial pain syndrome essentially is a trigger point or a very sensitive spot in a muscle. So or a trigger point is a hyper-irritable spot that you might feel when you're moving your arm or you're pushing on it or you're having it loaded so you're carrying something. And it happens because your muscles are typically kind of like this, and then either a trauma or you have some poor posture, you're not moving as much, you're anxious about something, causes your muscles to tense up, and you get this little knot that forms in your muscle. So how we treat it is either by trigger point release or lengthening your muscle or stretching. You could work on your posture, your ergonomics, which we have some really good videos on that if you want more information on that. You can do some yoga or learn some relaxation techniques if it's caused by anxiety. So we're going to talk about a couple of muscles that are typically affected by your breast cancer treatments. So the first one here is going to be your pec muscle, which is up in here, which usually has the trauma from your surgery or the radiation itself. So what you would do is, if you're going to work on it at home or here in the clinic, we kind of put some pressure here, some light pressure to start, and then you can go deeper as it feels better. At home, you can get a ball, kind of rope on it a little bit. You can do a doorway stretch, so you kind of come in a door and kind of stretch back, let that lengthen out. Make sure your posture is nice up and tall. You can also get a rolled up towel or a foam roller and lay on top of it. And just kind of let your arm hang out, stretch, and it'll stretch open that area that's really tight. And you might feel this directly in that spot that's kind of tight and sore, or you can have referred pain, which is where you feel it kind of down into your arm or your hand. Another spot that's typically really tight, sore, you get trigger points in it, your lats, which is on the back here. You might feel the pain in there or down on the inside of your arm. You can also take your ball and roll on it in that area as well to try to loosen it up. Your back of your muscle, your back of your shoulder muscles typically get pretty tight and sore. And again, you can go on a little lacrosse ball, tennis ball, or you can get a Theracane, which is one I just got off of Amazon, and kind of, do a little pressure there, nice and light. Some stretches that are good for that. This is like a crossed arm stretch, or you can get a towel, kind of pull up this way, just stretching that way, just to give yourself a nice little stretch. And that's it. So if you have any questions, please feel free to call us or email us. Again, my name's Amanda. I'm the occupational therapist and lymphatic therapist here at Cornerstone.